Hi everyone, my name is Caden Emerson, and today me and my team are going to be presenting the argument about why healthcare should be a right in the United States. What I'm going to focus on the first part of the presentation is laying out what our claim actually means, why this principle matters, and how our current system is making it difficult for people to get the care they need. After that, I'll talk about some of the data and show you a graph of the uninsured rate in America and talk about how universal healthcare can help with this. Our core claim is that healthcare should be a human right for every individual in the United States. When we say right, we mean something that people are entitled to just because they are human. Everyone gets sick, can get hurt, ages, and everybody deserves the chance to get healthy without falling into a massive amount of debt. Seeing healthcare as a right sets a standard for the system to help people out rather than leaving them to navigate the high cost all on their own. A rights-based model shifts the focus towards fairness, dignity, and consistency. Now that the claim is clear, we can look at why the current system does not support the principle. In the United States, access to healthcare is extremely uneven. Basic treatment can often come down to someone's income, their job benefits, or even where they live. Many people have insurance that technically exists, but the out-of-pocket premiums can become so high that they often never use it. Because of this, people often delay their treatment, allowing their health to become a lot worse. These barriers create serious consequences. People often delay trying to get treatment because of this, and that often packs emergency rooms and hospitals. Families end up stressed and unstable because they're constantly weighing medical needs against their basic living expenses. On a larger scale, untreated health problems decrease productivity and end up putting a strain on local hospitals and emergency rooms, as I stated. All of this supports the idea that our system is not functioning in a way that helps people. It functions like a marketplace, and marketplaces do not guarantee fairness. That's why we argue that the foundation needs to switch from a market model to a rights model. On this slide, I'm showing a graph of the uninsured rate in the United States from 2008 to 2024. What we see here is a clear pattern. After the Affordable Care Act was introduced, the uninsured rate dropped significantly. Unfortunately, in recent years, we have seen it climb back up. What matters about this trend is that it's fragile. When coverage depends on employment or income, we can see it quickly disappear during economic downturns or personal transitions. A system built on rights would create stability rather than volatility. This data helps show how inconsistent coverage can become whenever healthcare is treated as a privilege rather than a right. Now that we've looked at the current system and seen just how unsuccessful it can be, I want to talk about why universal healthcare is a solution. Universal healthcare takes away the idea that getting sick is some sort of financial burden, when in reality, it should just be a right for all humans. One of the biggest advantages is fairness. Universal healthcare creates a system where people are treated according to their health needs rather than their income level or job. It takes away the idea that getting sick is some sort of financial burden. Instead, it treats healthcare as something that everyone deserves, bringing a sense of dignity and fairness to all people. Another major benefit is going to be the health outcomes. When people aren't worried about the financial risk, they're more likely to go get treated early and often. Right now, a lot of people are waiting until things become seriously bad, which is bad not only for people, but also for the system. Universal healthcare shifts the focus towards prevention, keeping communities healthy longer and live longer. When healthcare is guaranteed, it helps family out by not making them choose between paying their bills or paying for treatment. It allows people to focus on their lives rather than worrying about what's going to happen to them when they get sick. Universal healthcare makes the system more efficient. When people aren't relying as emergency rooms as a first line of care, providers are able to get to people way early and often. This reduces overcrowding and decreases long-term costs. An organized, rights-based system is easier to plan for and adjust to over time whenever people's health is being attended to rather than worrying about a net profit. So overall, universal healthcare is not just an ethic idea, it's also a practical one. These combined benefits show why universal healthcare system will lead to a longer living and better society. I want to thank all of y'all for listening, and now I'm going to pass it over to my friend Demarion.
Hi, my name is Demarion Willis, and today I'm talking about my side of the universal healthcare. Today, concerns about universal healthcare. Even though universal healthcare has benefits, critics also worry about several issues. They argue that taxes might increase to fund the system. They also mention longer wait times for surgeries and specialists and say government-run systems can be slow or inefficient. Other concerns include overcrowding, low quality care, fewer choices in doctors, and less innovation because of less competition. These concerns don't make universal healthcare impossible, but these are issues people are bringing up. Here's some evidence behind those criticisms. Countries like the UK and Canada do have longer wait times, sometimes around 20 to 22 weeks for major surgeries. In Canada, over 1 million people waited to see a specialist in a recent year. A study in Korea showed that higher income people still use more healthcare even with universal coverage, meaning inequality doesn't disappear completely. And Asian countries with universal systems also spend more than 10% of their GDP on healthcare, raising questions about long-term sustainability. This slide focuses on key data. In Canada, only about 62% of hip and knee surgeries are done on time, meaning 4 out of 10 patients wait too long. Also, around 9% of Canadians reports are not getting needed care, which is higher than other countries with universal systems. Many countries with universal systems spend a large share of their economy on healthcare, around 9-11% of GDP. And even as more surgeries are performed, demand is still growing faster than resources. These are big questions critics ask. Can the government run such a system efficiently? Will taxes increase too much? Will wait times get worse? Will people lose choice in their doctors? These questions matter because if universal healthcare is the goal, the system still needs to be designed in a way that works long term. Overall, the evidence shows that universal healthcare has real strengths, but also real challenges. Countries with universal systems do struggle with wait times and resource limits. Even with full coverage, income-based difference in usage still exists, and aging populations create financial strains. The key point in universal healthcare is achievable, but it still needs a strong planning, a strong future, a strong funding management to avoid these issues. These are the studies that we use both sides of the argument. They come from reviews and research, international health organizations, and academic studies. We want to make sure our presentation is based on real evidence, not just opinions, which matters, especially with a topic like this, because you're talking about life. You're talking about everything. Talking about how you go to the doctor. So these things are very important that we make sure we bring you the best evidence and the best supporting things, so you have the right mindset about this.